And welcome back. Montefiore School Health Program consists of 27 school-based health centers located in elementary, middle, and high schools throughout the borough of the Bronx. Serving about 40,000 students in 92 schools, it's the largest hospital-sponsored program in the country. Here to tell us a little bit more about it, we welcome now Dr. Delaney Gracy, Director of Clinical Services at Montefiore School's Health Program, and we welcome you.
Thank you. Thank you so much.
Good to have you. So when we talk about being the largest, first of all, that's a great number to have, the largest in the country.
Thank you, and we're growing as well.
Wow. Talk to us about the state of the Bronx, because we know the Bronx really has some challenges. Number 62 out of all counties when it comes to obesity and, things of that nature. How are you helping to tackle this?
Well, one of the things is the model itself with having a clinic for students within their school. So we don't just do Band-Aids and ice packs. We do full-on medical care like you'd get in a primary clinic. So we do vaccines, we do physicals, we do chronic care management for things like asthma and for things like obesity. And that can make a real difference when you have working parents. Taking off work to go to the doctor is hard, taking off school to go to the doctor is hard, and this is one more way we can help kids get care and families to get what they need.
So walk me through the possibility of services. So a person walks in, what are they in for?
So again, it's just like a clinic that they would go to in their community, and we're part of Montefiore and the system of community clinics that we have. We're in the schools specifically to serve the students, and so when they come in, we can do a physical. We'll check and see if they're up to date on their vaccines. We can check vision, hearing, all those things that are also really important for them to be able to learn at school and stay in class more. And we see a lot of kids with asthma. We do a lot of reproductive health in the high schools, and the goal is keep kids safe, healthy in school so they can pay attention and they can do well in school.
How much of a difference maker is it having that right there in the school system?
I think it makes a big difference because we have an integrated model where we also offer dental services, mental health. We have a lot of community programs, so we do a lot of work in the classrooms and school-wide. And so I think it makes kids able to take a little more control of their health and take a little more initiative in being healthy. And it also, if you can go down to the clinic for 30 minutes versus have to take off half a day to get care, then for a lot of kids, that makes them more likely to get it.
Right. Talk to me a little bit about response from parents and teachers being able to have, these services right there at their disposal.
Sure. Well, again, with the schools also, their goal is to keep those kids in class and to have those kids healthy. And so being able to have the other services like mental health support and the health education, community education support even adds that extra layer on to the traditionally medical part. And we, talk on the phone to parents all the time. When we see the little kids, we always try to get their parent on the phone while we're seeing the kid. We send home a lot of letters and try to really make sure those communication lines are open, as well as if they have a doctor in the community, really working with that doctor too, to, collectively in partnership, provide really good care.
Right, and social workers are a part of this as well.
Right, social workers, psychologists, we have different outreach workers, we have what we call community health workers that do a lot of programs and even have programs for families that, help with cooking and eating healthy and being fit.
So for people who want to find out more information about this, what do they do?
So they can look at the Montefiore website or the Montefiore School Health website, or they can also, give us a call at School Health. And we have a list of the schools where we are. And so we have the 27 now, but over the next 2 years, we'll be adding another 10 to 15 clinics as well.
That's awesome. That's awesome to be in so many places and to be able to meet the needs of kids. The turnaround in terms of, as you said, keeping kids safe in school, being able to have a healthy learning environment. What are you hearing? What's the feedback to that?
To the school environment now?
Well, basically, yeah. Now that you're able to keep kids in, a classroom, they can go to class, they can stay there, right there at school. It's got to be a positive feedback in terms
Absolutely, absolutely. And the parents, they appreciate it very much. I was on the phone with the mom the other night doing, going through the questions to be able to do the physical for her kid. And that allowed her to not have to miss work to do that, but we could still get her child the care and the forms so that they could do the after school program. And so it really, these are the pieces you need as a parent to hold your life together.
Right.
And sometimes help and access are not so easy to get.
I think you spoke to two of the big things, because parents worry about the physical, right? And then, if you want to do an after-school program or sports, sometimes getting to that doctor really becomes a challenge.
Absolutely. And, when kids have chronic health problems like asthma, some families, it's a struggle even to go to the emergency room when you really need it. But we all know we can give better care if we're seeing those kids regularly and really managing that medication day to day. That way, if they can come to us, we can do that. And similarly with things like physicals, some parents have to choose not to do that because it's hard to take off work. When we can do it for the kid in school, we can find out if they have a vision problem that may be actually impacting how well they can do in class. And so it gives us that connection point, and then to also work very closely with the schools in partnership.
Tremendous win-win. Now, it's the largest hospital-sponsored program in the country, and as you said, you're growing.
We are.
Yeah, so looking forward to it. Thank you so much for coming and sharing with
Our
us.
pleasure. Thanks for bringing the health of kids to the conversation.
No, we love that. Dr. Delaney Gracy, she is the Director of Clinical Services at the Montefiore School Health Program. We thank her for joining us, and we thank you for joining us. No, we're not out of show. We got more show coming up. Stay with us. We got more right after this.